Hello, Dr. William Berger here. I'd like to take a moment today to talk to you about some new developments in the weight loss medication space. I'm referring here to the FDA approval and now availability of oral Wegovy. So we're talking here about semaglutide, and you've probably heard of it in the injectable forms of both Wegovy and Ozempic, where they are once per week injections. However, the Wegovy oral formulation is going to be a pill taken once daily. And of course, it has a lot of advantages for those folks who are averse to needles, don't feel comfortable injecting themselves. And it should also be a little bit less expensive than the injectable forms of medication. So, again, we're talking about semaglutide, GLP-1 receptor agonist medicine used for weight loss and for diabetes control. Now, there has been an oral form of semaglutide on the market for quite some time for diabetes. That's called Rybelsus. It's at a much lower dose than what the oral Wegovy will be available as. And while it can be a decent supplemental kind of medication for diabetes treatment, it doesn't really do a great deal for weight loss or reduce the risk for recurrent heart attack or stroke like the injectable form of Wegovy does, and now the oral form is FDA approved both for weight loss as well as decreasing risk for a second cardiac event. So, as I alluded to, it should be, as far as I can tell at this moment, and it's now early January of 2026, it should be the oral form of semaglutide, of oral form of Wegovy, should be less expensive than the injectable form of Wegovy, and also the other big injectable on the market, which is Zepbound, the injectable form of tirzepatide. So as of right now, what I can find, it seems to be that the lower doses of oral Wegovy are going to be about $150, and the higher doses will be in the order of $300. The lower 150 price may go up to 300 or so after the 15th, I believe, of April. This is all, of course, subject to change, but this is what I'm able to find for pricing right now. So between 150 to 300, depending on the dose for the oral Wegovy. The injectable Wegovy formulation is more on the order of $350 currently, and Zepbound is $300 to $450. Now, manufacturers' coupons for people with insurance, so what they call the insurance savings card, can get the cost of these medicines down to about $25 if you're fortunate enough to have medical insurance that covers these weight loss medicines. Some folks do and some folks don't, and it's a constantly changing insurance coverage landscape. In terms of the way it's taken, it is daily, like I said, and there's a specific way to take it. It needs to be first thing in the morning, 30 minutes before anything else by mouth, and with a small amount of water, just enough water to be able to swallow the pill, essentially. And that's kind of similar to some other medicines out there, like levothyroxine, synthetic thyroid hormone. You need to take 30 minutes before anything else, although with more water. Same thing, Fosamax for osteoporosis. So this isn't the only oral medicine out there on the market that you need to take in this particular kind of way. And I don't think it's going to be a huge barrier, especially for folks who would rather save a little money and not use a needle of some kind to administer their weight loss medicine. In terms of the brass tacks here, how much weight loss can we expect from the oral Wegovy? Well, it's pretty much comparable to the injectable Wegovy, on the order of 13 to 15 or 16%, which is pretty good weight loss and better than most of the oral medicines that we had before the injectable GLP-1 and GLP-1 GIP meds came out. So, and this compares to Zepbound, one of the other injectable medications, which can offer about 20 to 21% weight loss on average over the course of 1 year at the maximum tolerated dose. And also the benefit, remember, for Wegovy, for folks who have been unfortunate enough to have heart attacks and strokes, it's going to decrease your risk, and it's FDA approved for that to try to avoid having another event. So basically, it's another great development in the rapidly changing weight loss medication space. There are many other medications in the pipeline. Some are nearing FDA approval. Some of the trials are still underway, and we're a little bit further out from when they might become available to the public. I'm going to be recording more videos and podcasts about those medicines as they become available. But for now, this oral semaglutide, oral Wegovy, is a really great option for patients, especially those who don't like to use needles, and also it might be a little bit less costly. So bear in mind that everything I talk about in these videos is for educational purposes only. No doctor-patient relationship has been formed. And if you have particular questions or concerns, don't hesitate to reach out to your medical professionals. If you'd like to learn more about what we do here at Northeast Medical Practice, we are a concierge-style internal medicine, weight management, as well as menopause treatment practice. I'm certified or boarded in all three of those things. We are located in Great Neck, New York on Long Island. The number in the office, online at northeastmedicalpractice.com, through all our social media outlets, including our YouTube channel, and also my LongevityMD podcast, where I interview other physicians and give talks like these on all sorts of different topics regarding medical optimization of one's health. So I hope you've enjoyed learning a little bit more about oral Wegovy, and until we see each other next time, be in good health.